Good morning, everyone. I'm Sayukta from Vistas Media, your host for today on Hair All Issues Are Resolved YouTube channel. We go through a lot of look beautiful related issue as we grow up. But little do we realize that it's our hair that's our crowning glory. Our hair symbolizes health and personality. Gorgeous and healthy hair is an instant confidence boost. To guide us on how to take care of our crowning glory, that is our hair, we have with us an expert dermatologist, Dr. Meenal Mittal, live from Aligarh. Dr. Meenal Mittal is M.B.B.S, M.D., DBL, consultant dermatologist and dermatosurgeon at Mittal Skin and Aesthetic Clinic, Aligarh. She has over 9 years of experience as a dermatologist. She's a Bachelor of Medicine, Bachelor of Surgery, M.B.B.S, Medicine, M.D., Dermatology. Dr. Meenal is known for her command over the field of dermatology and enjoys the reputation of being both skillful and ethical. A very warm welcome to you, Dr. Meenal Mittal.
Thank you so much, Sayukta. So today's session is all about hair care in current scenario. So we will start. So we can take questions afterwards, I think, and we'll start with the introduction initially. So
definitely. The most common problem, Dr. Mittal, is that we all shed hairs on a daily basis. हमारे कपड़े पे बाल होते हैं, जब हम उठते हैं हमारे पिलो पे बाल होते हैं, जब हम हेयर वॉश करते हैं तब हमारे बाल शेड होते हैं. So we all know that on a regular basis we do shed hairs, but then we don't know what's normal and when to be concerned, when to be alarmed and go and consult a dermatologist like you. So, doctor, I think we should start from here क्योंकि सबसे आम क्वेश्चन जो लोगों के मन में होता है वो यही होता है कि कितना बाल झड़ना नॉर्मल है और कब हमें कंसर्न होना चाहिए.
So in normally it is like around 100 hairs. If there fall of 100 hairs daily, then it is normal. Less than 100 hairs daily fall is normal. But if there is fall of more than 100 hairs, approximately more than 100 hairs are falling every day. And if there is thinning of hair, no, the diameter of the hair, if there is thinning of the hair, and if there is sudden rapid increase in the fall of hair, so all these things are abnormal. So mainly it is like if your average hair fall is less than 100, now that you can make by just touching the thickness of the bunch that is falling. That if the less than 100 hairs are falling, that is normal. If more than 100 hairs are falling, then it is abnormal. You must consult a dermatologist if there is thinning of the hair, and if you are developing any patches in males in the beard region, in females in the scalp, or in the sometimes in the eyebrows or eyelashes also there is loss of hairs, patches develops in the eyelashes or the eyebrows area also. That is alopecia, and that is abnormal. And if there is patterned hair loss also, like there is the normal hairline is receding. Yeah, sometimes in males we have seen that this normal hairline is receding. That is the male pattern androgenetic alopecia. And in female pattern alopecia, that is like the anterior hairline is intact, but the crown area, there is balding in the crown area, and the parting line gets widened. The normal parting line, it gets widened. So that is a female pattern androgenetic alopecia. So if you have any of these features, and if there is more breakage of hairs, no? Sometimes there is the hairs break at different length. There's breakage of hairs, easily pluckable hairs. All these things are abnormal. If you have any of these signs and symptoms, you must consult a dermatologist and get a proper prescription for your hair.
Right. So you have very well explained, doctor, कि क्या normal है और कब concern होने की जरूरत है. So if we see more than normal hairs are falling, or thinning of hairs, or parting line is widening, or we can see patches in our scalp, we should go and consult a qualified dermatologist. Dr. Mittal, we would also like to understand what are the general causes of hair loss, why we shed hairs.
Okay. So the most common causes of hair loss are the like telogen effluvium. Sometimes when there is any kind of stress, trauma, or after any post-surgery also, there is acute fall of hairs. No? Sometimes we've seen that after a prolonged illness or chronic illness, after 2 to 3 months of recovery from a chronic illness, people start developing falling of hairs. The more than 100 hairs or every day are falling. Then it is called telogen effluvium. And if this hair fall persists for more than 6 months, then it is called chronic telogen effluvium. It may also be associated. The chronic telogen effluvium may also be associated with sometimes with iron deficiency, with zinc deficiency. It can also be associated with thyroid disorders. So these are all the causes that can precipitate the telogen effluvium. In telogen effluvium, there is diffuse fall of hair from all over the scalp. There is no particular patchy loss or nothing. All over the scalp there is diffuse hair fall. That is mainly that I've explained the causes, and sometimes postpartum also in pregnancy. After post pregnancy, after 2 to 3 months, females develop severe hair loss. That is post gravidarum hair loss, telogen effluvium. And sometimes some drugs also, like isotretinoin, retinoids, they also precipitate the hair loss. Radiation induced, chemotherapy induced hair loss is also all are other causes. Then there are patterned hair losses. That is the main cause of patterned hair loss is genetic or maybe stress induced or some environmental factors that can precipitate the patterned hair loss. And then there is the alopecia areata, in which there is development of patches of hair loss over the scalp or beard region in males. And this is if the hair loss is in the scalp or beard region, it is called alopecia areata. If there is alopecia all over the body, then it is called alopecia totalis. So there is there are patches of hair loss all over the body, and so these are the main causes. And there are other causes also. That sometimes in children, we have seen that there is the young adults or children, they pull their hairs easily. They unconsciously they pull their hairs, and so there's breakage of hairs at different lengths. Sometimes we see, which is very unusual, and because of this breakage, there develops alopecia at the side. So this is called trichotillomania. These are the most common causes of hair loss that we commonly see.
You're right. So there can be n number of reasons behind hair loss. We would also like to understand, doctor, what is the role of a healthy lifestyle in good, maintaining good hair health? How far our lifestyle plays a role?
A healthy lifestyle and healthy hair care are the most important factors in for maintaining the good quality of hairs and the hair texture. For that, most important thing is diet. Diet in which fresh fruits, vegetables, protein-rich diet, adequate intake of water, juices, fluid intake should be there. And for proteins, we can add sprouts or eggs in our diet, which can provide the extra proteins and biotin that is required for the healthy growth of the hairs. And then also we can add the nuts and cashews and almonds that are rich source of proteins and iron also that is required for the growth of hairs. So it is very important. Role of lifestyle is very important. Plus, the daily care of hairs is also important. The shampoos we use, the conditioners we use, they also damage our hair. If we are washing our hairs every day, so we must use very mild shampoos that are paraben free or SLS free. That because otherwise they can damage the hairs. If you wash hair daily with such shampoos which are which which have sulfates in them, then it can damage our hairs permanently. So it is very important to use mild shampoos if we are washing our hairs every day. And if you have oily scalp, you can also add antifungal shampoos in your daily routine that can decrease the oil from the scalp. And if you have
You'll have to unmute yourself, doctor. Yes.
Need the oil on the face also. No, sometimes we see ki if you have oily scalp, the face is all oily. So for that, it is important to. Am I audible?
Yes, yes, doctor.
Okay. So for
Please.
that, it is important to use the oil control face wash like salicylic acid, which absorbs oil from the sebaceous glands and decrease the oil secretion from the sebaceous glands. So there is, it prevents the oil on the face also. So, and plus the heat treatment, sometimes people are so fond of heat treatments to the dryers and blow dry and all these things. They damage the cuticle, they permanently damage the cuticle of our hairs and causes frizzy and damage the split ends. Sometimes we have that, all are because of the heat treatments. And so all these things are very important for the daily routine care of the hair.
Right. So both lifestyle and taking good care of your hair is very important. Diet, as you said, is very important. Now, as we were talking about diet, doctor, I would also like to understand, do you think nutrient supplements can prevent hair fall? And in addition to that, because most of the time, initially, as you said, in case your hair shedding is not normal, it's abnormal, you need to go and consult a dermatologist, a qualified dermatologist. But the thing is, I'm sure you'll also agree with me. People normally go to the chemist shop, they'll buy, few nutrient supplements by themselves without even consulting the doctor, and they'll start popping up. Uh, and because of all the, influencers, etc., which is flooded in the social media, people these days are so uh, they are full of informations, etc., so they know that biotin is one thing that we need to have if we are shedding hairs, or zinc or iron, etc. So the role of nutrient supplements A and B, is it okay to have it by themselves, or we need to go and consult a dermatologist before that?
Okay. People already know that biotin is important for hair care and hair nutrition, but adequate quantity of biotin is much more important. If you are taking biotin in less than recommended requirements of biotin, then it is of no use. So we must consult a doctor and get a prescription for the proper biotin supplements also. If we are taking it on our own, then we are not sure that it has the adequate quantity of biotin that we require for the hair growth. So biotin is one of the nutrition that is required for the hair growth, and others are like iron. Iron is very important for the hair growth. The iron is crucial for the growth of the hair matrix cells. So iron is also very important. Besides biotin and other nutrients like selenium, magnesium, calcium, all these things are also equally important. Along with biotin and vitamins like B12, D, vitamin D, and in some cases vitamin E is also seen beneficial for the hair growth. So all these things are adequately must be investigated before starting any treatment of on nutrients. So that for that you have to consult the doctor so that you can get your required investigations done, and accordingly the you can get your uh, supplements, because haphazardly taking the supplements is of no use. Um,
So rather than wasting our time, energy, and risking our health by buying the nutrient supplements by ourselves, we should go and consult a qualified dermatologist. We would also like to talk about the treatment options, doctor. For instance, if somebody is shedding hairs which is not normal, what is the line of treatment you usually apply?
okay. So first of the uh, first treatment is the supplements. We start with the supplements. Excuse me, now. I just.
Sure.
We start with the supplements, and along with the supplements, we give other oral drugs which are available for the hair growth. Some drugs like minoxidil, finasteride, dutasteride. In oral preparations also, and in topical preparations also, the minoxidil in different strengths is available. That is prescribed by the doctor according to the problem, according to your grade or severity of your alopecia. It is prescribed minoxidil. Then there is finasteride. Finasteride is also available in topical formulations and in oral formulations. And then there are non-surgical treatments available for hair growth, like PRP therapy, mesotherapy. These are available, and surgical treatments like hair transplant.
So we have like topical, oral, non-surgical, and surgical options of treatment, right? Another very common issue in our society related to hair is dandruff, doctor. People have dandruff, but they don't know, why it happens and what is the cause behind it and what should one do. So in a very normal practice, we'll often use shampoos that, claim to be effective over dandruff, or we would love to apply oil, because again we are so obsessed with applying oil on our scalp. So how does dandruff happen, and is it contagious, and what to do if we are suffering from dandruff?
Oiling, people are so fond of oiling. Oiling is good if you are doing it in 15 to 20, once in 15 to 20 days. Otherwise, every alternate day and every week, it is not required. Oiling is beneficial for improvement in the circulation of the blood in the scalp. So it is okay if you're doing it once in 15 days or 20 days. Otherwise, especially if you have oily scalp and you have seborrhea or dandruff, you must avoid oiling.
Okay.
And switch to antifungal shampoos that decreases the oil secretion from the sebaceous glands, and that decreases the secretion of oil from the sebaceous glands. And antifungal shampoos can be used every alternate days or twice in a week, so that it can prevent the secretion of oil from the glands, and thus there is and afterwards we can decrease the frequency of the shampoos to control the oil.
Right. So again, in case we are having dandruff, we should go and consult a qualified dermatologist so that we know exactly why it's happening and what should be done, and the doctor can suggest the shampoos, etc. Are there any other treatment options available for dandruff? Because for some, it's the dandruffs are really stubborn. They don't go by themselves, or they don't go that easily.
Oh. Along with antifungal shampoos, we have coal tar and salicylic acid preparations also available, which are beneficial in preventing seborrhea from in the scalp.
Right. And doctor, can dandruff lead to hair loss?
No. It can aggravate hair loss, but it is not the cause of hair loss.
Okay. We have so many questions from our viewers. I'll pick some of them. Gitika Sharma is here asking, is my hair loss permanent or will it grow back? So, because, normally when we lose hairs, a very common concern is that are we going to get back these hair, or is it going to be permanent?
Gitika, hair loss is not permanent until and unless it is scarring alopecia. It is not permanent. If you consult your doctor and you'll get a prescription and get the proper drugs, surely you'll get have the hairs back.
Okay. Gehna Sahu is asking, is hair transplant surgery helps in grow new hair?
Yes, definitely. Hair transplant surgery helps in getting back new hairs.
Okay, right. And Manju Mehra is here. Her question is, I'm having thyroid. Could it be a reason of hair fall?
Yes, thyroid, I've already discussed, it is one of the most important causes, hyperthyroid or hypothyroid. It can precipitate this hair fall. So it is important if you having hyperthyroid or hypothyroid to get a proper treatment of the thyroid disorder to control hair fall, along with the
Okay.
treatment of the hair fall.
All right. Poonam Pag is asking, is hair serum and hair gummies good for hair health?
Sorry, uh,
Hair
can you repeat the
serum,
question? Hair
yes.
serum.
Hair serum and hair gummies, the gummies of nutrient supplements in form of gummies. So are they good for our hair health?
Hair serums we can use because they are medically and dermatologically tested, and hair gummies they are not dermatologically tested. However, people are taking hair gummies also these days, but they are not dermatologically tested. But hair serums like they are procapil serums, which are if applied in adequate strength as advised by a doctor, they are beneficial along with the other medications like supplements and anti-hair fall shampoos. They are beneficial. The serums are available.
Fair enough. Asha Sharma, her question is, does onions regrow hair?
No, not definitely.
So what happens, doctor, whenever we see abnormal hair shedding, before going and approaching a dermatologist, we'll go run inside the kitchen and try something, dadi nani ka nuska, quick fixes,
Uh,
etc. People tend to apply so many things on their scalp, hair, and they think that they will work, and they won't need to go and consult a dermatologist. And in all the because they end up wasting a lot of time in trial and errors, and by the time they reach the doctor, many a times it's like you have actually wasted a lot of time. So what's your advice, what's your take on all those hair remedies that we do?
okay. Uh, Although people are still using the hair remedies uh, that are available at home, and some of them are using, but nowadays very good quality of shampoos and products are available in the market. If you go to the doctor and you get them for yourself, so it's better. And in home remedies, it is better to improve your diet and fluid intake and water intake rather than going for the home remedies. Sometimes we are not sure that which of them is beneficial, and sometimes they are also harmful for the hairs, and they also can damage the hair. So it is better to improve your diet and improve your nutrition, so that it can affect the growth and nutrition of your hairs and provide a good quality and good texture to the hairs.
Right. um Arhaman is here. His question is, does hair get thinner with age?
Yes, definitely. Hair gets thinner with the age.
Okay.
So as I told you, it is important to improve the nutrition, the protein intake, sprouts, salads, and green vegetables, and eggs. If you take eggs in your diet, you can increase and protein, any kind protein intake. It is beneficial to improve the thickness of the diameter of the hair. That gets if there is hair thinning because of aging. So nutrition can be improvement in nutrition can be beneficial for the hair growth.
Okay. Nana Verma is here asking, which juice is good for hair health?
Okay, juice, all kind of juices, because the juices have antioxidants, vitamin C, citric juices, they are
Mhm.
beneficial for the hair growth.
Right. Uh, Sneha is here. Her question is how to protect our hair from split ends. Split ends again is a big issue, especially with women's, with girls, etc. So how to prevent our hairs from
Split
split
ends, as
ends?
we have discussed, the most common cause of split ends is if you're because of excessive heat treatment or excessive dryers, use of dryers. So the tar drying or the natural air drying more is not harmful than the it is the
Right.
blow drying is harmful. Then the so it is important to dry your hairs in the air, or the you can go under the ceiling fan or dry your hairs instead of using the dryer. So
Right. So heat or excessive temperature, they are actually
and
not good for our hair.
sometimes coloring treatment also, no, the colors they use for hairs, all these things can also
Right.
damage the cuticle of hair, and split ends can occur.
Right. As you mentioned colors, because these days a lot of people are using colors, and they many a times do it by themselves or go to the saloon and get it done there. Is there anything particular to look for when we are buying the products or using a particular product, like in shampoos, as you said, that if it's sulfur free, it's good, So here, anything in particular that we can look for or check for while buying those products?
For colored hair,
Coloring. Yes, yes.
coloring hairs, there are shampoos available particularly for the actually the color. If there is any color treatment to the hair, it damages the superficial layer or cuticle of the hair, which is so
Okay.
the hairs are more vulnerable for the UV damage, the sun damage that occurs because after the coloring treatment. So there are shampoos and conditioners also available which protects from the UV damage if you are using any type of color for the hairs. So there are shampoos and conditioners also available for such colored
Right.
hairs.
Right. A lot of people are using, they are using ironing on a regular basis. As you said, excessive heat could be bad, so we should avoid irons, etc. Right. And we are also going for rebounds or permanent straightenings, and they all require a lot of chemicals, So, what should we do? I mean, many times, it becomes difficult to completely avoid or ignore these treatments. But then, is there any way that we can minimize the damage?
um, After because of heat treatment.
Heat treatments and chemical treatments like rebounding, straightening, etc.
For that also, they're mainly the heat treatments and rebounding treatments. They are harmful because they damages the superficial layer of the hairs, and thus there is UV damage, more UV damage to the hairs than the normal hairs. So it is important to use the UV protectant shampoos and conditioners available, so that they protect the form a layer around the over the hairs and protect them from the UV damage.
Okay. Again, because we know that skin or our scalp or our hair is what get very easily damaged by the sun rays or UV rays, right? Now the thing is, for skin, we know there are sunscreens available, but is there anything that we can do to protect our hair from the extreme sun or heat, the natural sun, the natural heat anyway?
That for that we can use, if we are going out in sun, we can use a hat or scarves we can use to cover our hairs. And a good quality of conditioners and masks, if we are using, they also provide adequate protection from the UV damage. And otherwise, we can physical protection. We can use scarves or hats that can protect the hairs from the UV damage.
Right. Initially, Dr. Mittal, you said that maintaining good hair health also requires taking good care of your hair. Now, today, as we were also discussing during our conversation, these days a lot of influencers, a lot of advertisements, market gimmicks, so much of these things are happening that we end up buying like 50 products for our hair. So we have, various products, and our, dressing tables are full with products that claims to make or keep our hair in healthy condition. Now, the question is that what are the basics that we should go for? I mean, you said it's important to get a good shampoo, a good conditioner. What are the basics that we can, go for and that can actually help us in maintaining good hair health?
Okay. It is important to wash your hairs every alternate days. To and use a mild shampoo, which will not damage the hairs. Use mild shampoos and wash your hairs every alternate day, so that if there is any excess dirt or sebum or oil in the scalp, that can be cleared off, and it will not increase the problem of dandruff or seborrhea in your scalp. So it is important to wash your hairs every alternate days. It is important
Right.
to protect your hairs from the UV damage also by using physical protection, by using hats or things like scarves you can use, and good quality of conditioners and masks we can apply to prevent UV damage. If there are colored hairs or excessive heat have been used, and we can also people have concerns regarding the if they're using dyes, and sometimes so dyes, if they have any ammonia ingredients in them, they can also cause contact dermatitis. So we must go for the dyes which are natural, which have natural ingredients, organic ingredients in them, that do not cause any kind of contact or irritant dermatitis, and they're very safe for you. So all these things, and along with diet, nutrition, supplements, and good hair care, and all these things can are beneficial for the hair.
Right. And as we are, going through the, summers are here in most parts of our country. And during summers, because we tend to sweat a lot, so we see a lot of frizzy hairs, and it becomes really difficult to maintain hairs. Any tips, particularly for this season for summers?
For summers, as I've told you, because of excessive oil, the excessive sweating and excessive oil in the scalp, it is must to wash the hairs every alternate days.
Okay.
Along with the good hair care, it is must to wash your hairs every alternate days.
Right. So keeping our scalp, clean and clear is really important. And for that, we need to wash them every alternate day at least. And doctor, as we are almost, in a stage where we are concluding the whole session, any takeaway message for our viewers? Anything that you would like to say, or any message for our viewers?
Okay. Along with all the things we have discussed, it is one thing I would also like to share with you, that sometimes we do not take notice that we some people, they use hair bands or rubber bands, they tie them so tightly that it can damage the hairs. If we are using bands also, they are this area, they are so tightly using the bands, it pulls the hairs, and sometimes there is alopecia also because of the tight pull by the bands. So it is very important to take care that if the bands or hair bands or rubber bands we are using should not be tied very tightly or should not be put very tightly, so there is a pull on the hair that can cause alopecia. And sometimes it is reversible also, but sometimes it is irreversible also if there is prolonged tying of hairs or bands or over the scalp, and it can lead to irreversible alopecia if there is damage to the hair follicles. So all these things, if taken care properly, the hair care hair care will be good for everyone.
Right. So, good and healthy lifestyle, very important is your diet. It's always important to take care of your hair for good hair health, and also take care of the practices that we often do, like avoid excessive heat or treatments that includes a lot of chemicals or heat, etc. And tying our hairs very tightly, etc. They can actually go a long way in damaging our hairs. And the very important thing and the lesson I think that we can, take out from this conversation is to go and consult the doctor, the right doctor, which is a qualified dermatologist, in case you see any abnormality happening with your hair or your scalp. So we need to go and consult a qualified dermatologist. That's really important. Thank you so very much, Dr. Meenal Mittal. It was a pleasure talking with you. And the whole, session was very informative. Your valuable guidance and advice on how to keep our hair healthy, especially in the current scenario where apart from our environmental and genetic factors, the increasing levels of pollution and stress, they are also taking a toll on our hair health. Thank you so very much.
Okay, thank you so much.
And I'm sure your guidance will help our viewers and viewers who want to get personal consultation from Dr. Meenal Mittal. You can visit her Facebook and Instagram by the name of by the name of Mittal Skin and Aesthetic Clinic, Aligarh. And in case you're at Aligarh or going to Aligarh, you can also go and consult her in person. Big thank you to all our viewers as well for watching this show. And for more information on how to get all your hair issues resolved, do like and subscribe our YouTube channel, Hair All Issues Resolved. Thank you. Have a great day ahead. Goodbye.